Ken Milne here for CAEP19. It is day 3. We are still talking between two lobsters, and I have Dr. Don Melady. And Don Melady is here because we did some videos with millennials because young docs rock, but we also wanted to do a few videos, don't take this too personally, old docs rock. And you can tell by how many ribbons he has. We don't say long in the tooth, but he's long in the ribbon department. So you know that he's been kicking around for a while. But we brought you on because you're a geriatric EM superstar. And so, Don, welcome to Talk Between Two Lobsters.
Nice to be here.
Oh yeah, sure it is.
I'm a millennial too. I'm just from a different millennium.
A different millennium, that was good. Yeah, so what's happening? I mean, you know, it's not to point out about your age, but anybody involved in emergency medicine these days is going to have an increasing volume of people that are older, and I don't know what's the correct term to use, whether it's older, senior.
People is quite cool.
Is that cool? Older
people,
okay. Because I tend to use the term based on your maturity, and then they usually look it back and they'd say based on your immaturity, but based on your maturity. So there are some real challenges, and I know that the American College is certifying emergency departments. Accrediting, sorry, I want to use the correct term, accrediting, and that's with Dr. Chris Carpenter and his initiative. What's CAEP doing to address geriatric emergency medicine?
Thanks for bringing it up. In fact, I'm involved with CAEP and actually wrote most of the criteria for the accreditation.
Did you see that? He just took credit for accreditation, Chris. I hope you're watching.
Not with Chris. It's a shared project among 10 of us who are interested in how we change the systems that the emergency department systems where people get their care.
But this is super important, isn't it?
It is important. So as I said in our track yesterday, even 10 years ago, in Canadian Emergency Department, about 10% of people were over the age of 65. I know it's
10%.
Only 10%.
That's twice my favorite number, though. Five? I can count to it on one hand.
Okay, so as recently as 10 years ago, only about 10% of people in the emergency department were over the age of 65. I know for you people who've been doing it for a long time, it always seems like it's more than that because they stay a long time, they're very complex, they use a lot of resources, you make a lot of consultations, they're difficult to dispose. There's a lot of different things you have to consider. So it always seems like there's a lot of old people around. About 10 years ago, it was about 10%. Currently, in Canadian emergency departments, it's about 20%.
So it's
One
doubled,
in five.
doubled in the last 10 years.
And it's important to remember that the baby boom only started hitting 65 about 5 years ago. So we were nowhere near the peak of the baby boom, which means that 10 years from now,
we can expect to see more?
We can probably expect around 35%. So 1 out of 3 people in your emergency department will be over the age of 65. So I think emergency physicians and emergency department systems have been kind of closing their eyes to that reality and thinking that they'll deal with exactly. I'll deal with that when it comes. So it's actually coming, and it's almost here. So there's a couple things that need to happen. One, clinicians, doctors and nurses working in emergency department need to know more. There's just like core geriatric content that you need to know. So we talked. CAEP offered the first ever geriatric emergency medicine course as a pre-conference course here on Saturday. 15 people from across the country, the smart ones, came to attend that course. And I think they were mostly like mid-career and older career folks, and I think most of them would say that they learned a lot of stuff they didn't know. It amazes me that. Do you know what BPSD stands for?
No, I know PTSD, okay, but I don't know what the other.
So BPSD is actually, for anybody who deals with older people, it's like a really core concept. It means the behavioral and psychological symptoms of dementia. If you say that word BPSD to any geriatrician or any people who work with older people, they just know. I think there's probably 10 emergency physicians in Canada think about the behavioral and psychological symptoms of dementia, even though, and probably 1 out of 4 older people who we see in an emergency department have dementia, and everything, all the interactions and encounters between you as a clinician and them as a patient is colored by the fact that they've got dementia. Yet we don't really have a good understanding of dementia what it looks like in the emergency department. And then just core topics like delirium. Are we very good at detecting it? And if we do detect that somebody has a delirium, knowing that 70% of geriatric delirium is not the agitated older person, but it's actually the quiet, sleepy, sedated, withdrawn older person. So just knowing that 70% of all geriatric delirium is hypoactive. Once we do identify it, do we have a good systematic way of investigating delirium? Do we think about function and how older people are functioning as a symptom of their presentation? So we generally don't ask. We look at the person lying in bed, looking not very good and with a gown on and under harsh lights, and everybody looks like shit.
I'm thinking, I have to bedazzle up for this, yes.
Just not to be too vulgar, but everybody looks like shit. So do we actually then start exploring in much more detail what is their baseline function? Because somebody who's actually a 92-year-old with a high level of function can withstand almost as much physiological trauma from injury or illness as a 60-year-old with a high level of function. So, but do we actually have a way of thinking about function and frailty? Frailty's the new sepsis.
That's the frailty.
Sepsis is so 2005.
But looking at some of the stuff that you were putting together with Chris Carpenter, with CAEP, with ASAP, a lot of the things that they were talking about for geriatric-friendly emergency departments could be applied to all patients. Like we could raise the level of our care for everyone.
So everything that's good for older people is good for all patients. So making your emergency department a more senior-friendly place is going to make it friendly for all patients. I think we don't spend enough time thinking about patient experience in the emergency department. There's a very drive-through mentality, and it doesn't really matter.
Can we supersize you today? Do you want fries with that? Yes. If there was one thing that you wanted to get across to the CAEP19 audience about geriatric emergency medicine, and this is your elevator pitch, this is like the one thing you want to get across, what would it be?
So the time is now. I think people with a vision have been aware that the silver boom, as I call it, not the great tsunami, because great tsunamis come as a surprise. This is the silver boom. We've known there was a baby boom, and now there's a silver boom. We've known for a long time that it's coming. It's not coming anymore. It's here, and there's a certain urgency, and emergency physicians always like urgency. There's a certain urgency to addressing this, both with what we know and do, and with the systems that we work in.
So I asked the millennials a few questions about movies, and my favorite movies are from the 80s. They gave me some of their favorite movies. Just to finish this up, do you have a favorite movie that you like?
I said hi earlier quickly.
You don't go to the movie? Okay, well a cultural reference can it be a play? Music?
Well, as anybody who came to geriatric emergency medicine track knows, I do sing in a choir, and
there we go. Music.
I introduced the track with a cut from Mozart's Great Mass in C minor.
Wow! This little 5-minute segment just went to this level with regards to sophistication. Thanks to Don. This is CAEP19. Geriatric emergency medicine is something we all need to get better at. Not just old docs that rock. All docs need to rock when it comes to taking care of geriatric patients.
Can I make one final pitch?
You can.
CAEP is making this course available, the Geriatric Emergency Medicine course. So this is specifically for doctors who want to know more about older people in emergency
Where can they find that? Where can they find information about that?
They can contact me.
Okay.
At the moment, or
Don's going to give out his personal phone number.
Carol-Ann Lapierre at CAEP.
Okay.
So we're interested, the course is up and available, we're interested in bringing it to any place that can assemble 32 physicians who want to pay for this.
Sounds good. If you're interested, we'll put some titling there for you along the screen, and you can contact Don, and you can be amazing doc that rocks when it comes to taking care of geriatric patients. Thanks very much.